We have been talking about back to school in September, and we've heard about Nova Scotia's and Alberta's plans to return to near normal, with virtually all students back in classrooms, of course, with new safety measures to go along with that. But Ontario is considering a more hybridized approach where different students would return at different times. But it all comes down to the same questions. How safe is it for kids to go back, and what can be done to make it safer? Well, joining me now, Dr. Alon Vaisman, an infectious diseases physician, and respirologist Dr. Samir Gupta. And doctors, let me start just by quoting Alberta Premier Jason Kenney. So he says, the evidence is overwhelming that schools can be operated safely with little health risk for children and teachers and low risk of causing serious outbreaks in the communities that surround them. So let's take that bit by bit. Dr. Gupta, how susceptible are kids to catching COVID-19, and how do they do when they do catch it?
Yeah, so the susceptibility question is a good one. We have some information on that. There was actually a review done by a group in the UK recently, and they reviewed a bunch of contact tracing studies and sort of screening studies. And what they found was that children have just about half the odds of contracting the virus from a close contact compared to adults. So they do seem to be less susceptible to actually catching the virus. The flip side of that is when you look at symptoms, and we've talked about younger people having less severe disease. Kids, if they do catch it, are less likely to be symptomatic. Up to 80% of kids, in fact, might have asymptomatic infection. But the problem with that is that we also have data to suggest that if they do catch it, although they may be as asymptomatic, they have a similar viral load to adults. In other words, they carry around a similar amount of virus as adults do, which implies that they're probably just as infectious as adults.
Right, and I guess that's the tricky part, right? When you combine those two things, the question of whether they are as infectious compared with the fact that they have that sort of heightened viral load for maybe what you might expect. Dr. Vaisman, what more do we know about the potential risk there for younger people to kind of be vectors for the disease? Maybe the greater threat is getting other people sick.
Yes, exactly. So in the group of recent studies looking at other groups of young people, including ages 10 to 19, might have as good a capacity of transmitting the virus as adults do. So the concern there being that if you to return to school, especially high schools, the young people, as was mentioned, are not going to have as poor outcomes, not going to do as poorly with the virus, but they do have the capacity to acquire the virus and potentially transmit it to people who they're living with at home, including adults, including their grandparents, including those who are more vulnerable and might themselves have poorer outcomes with it.
Okay, so then Dr. Vaisman, let me just ask you the simple question straight up. Is it safe for kids to go back to school in September?
I think we've learned from a lot of examples across the world in situations where it potentially might be safe for people to go back to school with certain measures in place to try to reduce the likelihood of transmission. We've heard a lot of experience from a lot of places around the world where they've done this safely, where we've a lot of lessons learned about when to pull back, when to open up. And I think in Canada, that same thing can be done safely.
Dr. Vaisman, what are some of those measures that you would expect every school to take? I mean, it's easy to think of the obvious ones, good hand hygiene, let's keep the desks apart. What else beyond that?
Yeah, so the hand hygiene, social distancing is important. Screening for symptoms when people arrive at school, including the teachers and the students, educating parents about symptoms. Making sure that there is masks available for students who are able to wear them so that they reduce the likelihood of transmission as well. Also having a backup plan to be able to transition smoothly between in-class teaching to classes outside of class is also an important step also to try to be able to do this very safely and effectively.
Dr. Gupta, let me put one of those measures to you. Dr. Vaisman mentioned making masks available. What about going one step further, making masks mandatory?
You know, I think the trickiest environment is that classroom where people are going to be together, probably not able to physically distance the appropriate distance, and they'll be for a prolonged period of time in a poorly ventilated space. That's the space where ideally we would want masks. I'll tell you that, you know, after a long day, I have trouble keeping a mask on without touching it and sort of contaminating myself, and that's part of my job. I think that although we would want it, for most children, it will be practically impossible. I think it's a very challenging thing and very difficult to mandate because of that.
And does that risk of I mean, just being sloppy with the handling of the mask, does that really outweigh the benefit of wearing the mask and potentially sort of blocking transmission of the virus that way?
hard to know. We do worry, if you're wearing a mask all day, partly it's to protect others from your own droplets, but also partly there's some protection for yourself. And if there is an infected party in that environment, there may well be virus on the surface of the mask if you've been breathing through it all day. So touching it frequently, and particularly taking it on and off, will take away from the benefit. And touching it frequently, if it's infected, can actually be deleterious. So that is the concern.
Excellent to hear from you both. Dr. Vaisman, Dr. Gupta, thanks so much for your time.
Thank you.
Thank you.